Good morning. I'm Adrienne Murray, and it's my pleasure to welcome you to the 2020 UMC Nursing All-Star Awards. This year's ceremony is special for several reasons. First and foremost, it's the year of the nurse, and what a year it has been. The ceremony has a new name, look, and feel, and it's a celebration that we weren't sure that we would have due to COVID-19, but here we are. Last but not least, as a new age begins, another era comes to an end. This is Terry Gillespie's last nursing award celebration as a UMC nurse. Terry Gillespie is Chief Nurse Executive Officer of University Hospital and Health System and Chief Nursing and Clinical Service Officer of the Adult Hospital. Jason Zimmerman is our Associate Chief Nursing Officer of Adult Nursing Services and has been named Interim Chief Nurse Executive Officer. Ellen Hansen is our Chief Nursing and Clinical Services Officer of Children's of Mississippi, and Victoria Butler is our Associate Chief Nursing Officer for Perioperative Services. It's such a privilege to be part of this amazing leadership team. I'd like to give a special thanks to our judges, our nominators, and the award committee members. Without you, we would not be celebrating our extraordinary nurses today. Thank you. For this ceremony, we are adhering to COVID-19 guidelines. Masks are required at all times with the exception of the person speaking at the podium. We ask that you sit in assigned seating only and do not rearrange the chairs. We also ask that you practice social distancing and utilize hand sanitizer available throughout the room. At this time, I'd like to introduce our Master of Ceremonies, Keith Hodges. Keith is the Clinical Intelligence Manager with the Center for Informatics and Analytics here at UMC. He has over 25 years of healthcare experience in the areas of patient care, clinical management, talent acquisition, quality, performance improvement, and informatics and analytics. Keith is a registered nurse and certified associate in health information and management systems. He received his BSN from UMC School of Nursing and a master's from MC in Health Service Administration. He's an active member of Mississippi Healthcare Information and Management Systems Society and the Mississippi Nurses Association, where he has held board positions with both organizations. All yours.
Good morning.
Morning.
Thank you. I think Adrienne asked me to do this because she realized I'm about to retire. I'm never going to get nominated, so this is the closest I'm going to get to the red carpet. I mean, if they had an award for who had the biggest mouth, I might win. If Margaret wasn't nominated, of course, right? So as Adrienne said, this is the year of the nurse. It is quite different, the ceremony that we're having now. Typically, we have this ceremony in May during Nurses Week. Of course, we had other things on our mind and at hand during that time. As the pandemic has progressed, there's been a lot of change in our daily work, change in our lives. And some of that has been negative impact toward us. But there has been one good thing that has come out of the pandemic, and that is the world's recognition that nurses are our healthcare heroes. It has really shone the spotlight on nurses and the work that we do and have been doing for years. And so that's why we're here today, is to acknowledge some of those great efforts from our nursing staff. Before we move any further into our program, I would like to thank our sponsors. Cups at Mississippi Methodist Rehab and PJ's Coffee and Fondren have donated our nominees their gifts. Next, I would like to ask Britt Cruz, the CEO of the Adult Hospital, and Guy Gieske, the CEO of Children's Mississippi, to please come forward with some opening remarks.
Guy and I did not rehearse this together, so we're going to see how this goes. We're going to see how good my vision is as well. So when first of all, thank you for the opportunity to talk today for a few minutes. And when I was asked to talk. I asked Charlotte what I should speak about, and she said, speak from the heart and as an organization what nursing means to you. And so first and foremost, I'd like to congratulate all the nominees, all the award winners, and all the nurses. As Adrian said, 2020, I've heard this like 20 times over the last several months, is the year of the nurse. And that's exciting, that's awesome, and we should definitely recognize that, and that makes this event even that much more special. So when I was thinking about what does nursing mean to me and to the organization, I thought about our values, and I've been talking a lot about our values recently, and how does nursing touch on the values? And so you start with quality and safety. And first and foremost, nurses always keep quality and safety at the forefront of everything that they do. And it doesn't matter if we have a high acuity day, it doesn't matter if there are too many patients in the hospital, no matter what, quality is always at the forefront of the thinking, and it is very much appreciated. From an innovation standpoint, I've had opportunity over the last 2 years to do several rounds on the floors. And I can't tell you how impressed I am by, one, the innovation around processes that have improved over those 2 years. And also, I'm pretty sure that if we had some duct tape, some gum, and a little bit of maybe rubbing alcohol, that any patient could still be taken care of. And when you're in an organization that doesn't have all the resources that we'd like to have, that's really important. Nurses are creative, and that is a must to work at UMMC from a nursing standpoint. Integrity. 2020, the 19th consecutive year that nursing was voted as the most trustworthy profession. Congratulations. That is unbelievable. 19 consecutive years. As an accountant, as a hospital administrator, I didn't see those two things very high on the list, so I'm very impressed. But we already know that. Nursing as a profession is at the highest of integrity that we could possibly have. From a diversity standpoint, when you look in the room, you have people here from all Mississippi counties. You have people in the room that are from all kinds of different states in the United States, different countries. It doesn't matter where, but you are definitely representative of the population that we serve each and every day. But you also have the challenges around dealing with physicians, families, EVS workers, administrators, social workers, case managers, police officers, and many more. And you do this with an ability to adapt quickly. So for that, we are thankful. Teamwork. UMMC's nurses excel in teamwork. We ask you to do all kinds of different things. We ask you to participate on the units from a team standpoint. We ask you to participate in the hospital and nursing teams, whatever it may be, and you always do so willingly. The most impressive part of the teamwork is on the floors, working with each other, helping your fellow nurses out on the floors, and we see that every day, and that's the only way we get through our days. So thank you for that as well. So from my standpoint, from an organizational standpoint, you are the heart and soul of UMMC. So thank you for that. Now, from a personal note, what have I noticed around nursing? Well, I have to tell the story, and some of you in the room know the story, as I had a 4-month-old child that was staying with my wife and I. His name was Joshua, still is Joshua. And Joshua was being treated at UMMC for leukopenia. Now, as a non-clinician, that sounded like a pretty big word. I had to look it up, went to my medical dictionary. And so his white cell counts were very low. The first thing that we did is we took him over to Northside Drive. Not the greatest clinic, we know that in terms of the beauty, but the nursing care that was at Northside Drive and then later at Specialty Clinic was spectacular. My wife was the one who took Joshua, and she kept talking about the nursing care that he received. The next step in Joshua's journey was that he received a blood transfusion in our cancer center clinic. That is where the nursing care was nothing short of miraculous. We saw Joshua as just this tiny little baby getting this huge transfusion. It looked like it. But somehow or another, the nurses there were able to keep this child calm for several hours as he received this blood transfusion. It truly was miraculous work. Then we go to when he had to get admitted to the hospital. Unfortunately, his white counts were down, and he spiked the fever. And we were told if his fever hit a certain temperature that he had to come. My wife gave me the call. I met her at the hospital. We took him to the emergency department. We walked in, and the only thing I can say about that was the care was totally compassionate from the nursing standpoint. It was really tremendous. Even the nurse who asked me to leave, because at the time, COVID, that we were only allowed to have one person and one parent or one guardian that was able to stay in the room. She did so compassionately, saying, "Sir, I'm sorry, but you're going to have to go." I was thinking to myself, boy, guy, that was a terrible policy to implement. But again, it was done in a compassionate way. He was admitted to the 4th floor because he had a fever and we had to roll out COVID. Now, I will tell you that my wife and I have 4 children between us, 2 each. And when you have a child that is not yours, that you are in care for, the worst thing you can think of is that somehow or another this kid has contracted COVID on your watch. That was what was in my heart. That was in my wife's heart. He's on the 4th floor, and that is where we receive comfort and reassuring care from the nursing staff. And for that, I will be always thankful. The next thing is then, thankfully, COVID test came back negative. Now he gets to go to the 3rd floor. This is where I finally was allowed to come because my wife was exhausted. She had been with him for about 36 straight hours and said, "I got to get some sleep." So we did the handoff. There I witnessed deliberate, confident, and empathetic care. It was great. I was there for about 6 hours, watched it. And the cool thing about that was recently, just 2 weeks ago, was doing some rounding, EVS rounding, and I went up to the 3rd floor, and 2 of the nurses looked at me and they said, "We know who you are. You are that little baby's father." Now, for some reason, whenever I go to the children's hospital, I'm never Brit. I'm always related to somebody. But that was really cool because that showed me how much our nurses invest in every family. So I hope you always remember that the patient care you provide each day is impactful. You never know who the person or family is on the other end of that extraordinary patient care. Again, congratulations to the nominees, to all the award winners, and to all of our nurses. Thank you.
So I will just say I feel a lot of the same sentiments. I've not cared for a patient, a foster child like Britt has, but it's personal and professionally. Nurses, I've seen the work every day and on the personal front, and I can't think of a better group of people. I also want to say congratulations to the nominees and to all the people that nominated you. So that's an outstanding accomplishment. One story I just wanted to share. So Adrian asked me to say, just speak what nursing means to you. So I'm gonna, and bear with me on this first story because it's evolved. But so growing up, I knew nurses. You know, I'd come in contact with them and had family members that were nurses and different people. But when I got out of college, I started graduate school at University of Houston and a Master's in Health Administration program. And I said, well, first I need to get a job in healthcare. So my first job was in billing and collections in a big business office. No contact with patients, nurses, anybody, doctors. And so I did that for about 8 months, and I was like, I got to do something else. So I got a job in registration, and by the way, having a bachelor's in business degree, if you're trying to get into healthcare, doesn't mean squat. So, so I started, and then so I got a job as an admissions registration representative at Memorial Hermann Northwest Hospital in Northwest Houston, and so as part of that job, I was also the cashier for payments, and so, but on weekends, so I did registration, admissions, and on weekends, this is how different times were, I ran the bed board. And so, no clinical knowledge, and so, anyway, so they trained me a little bit, and this was like the first weekend I did it, and they were like, just when a patient needs a bed, you know, and these were, a lot of them were semi-private rooms. So match the blue with the blue, meaning the boys with the boys, and the girls with the girls, and oh, you can only do, you know, women on this floor and OB over here, and, you know, all these clinical criteria, and I'm like, what does that even mean? So, but anyway, my first weekend doing this, I really got confused and flustered, and the first nurse I think that I came in contact with in a professional way from the ER just calls me up, and I think she was like the charge nurse, just starts yelling at me because I didn't have my stuff together. I was doing a terrible job, and just was really yelling at me, trying to get me, hey. And so I start griping back at her, and anyway, eventually my boss found out about it, and so my first interaction with the nurse was that I got in trouble by my boss because I wasn't doing my job, and then I started getting upset with her too. I was, I guess, 22 or so, but anyway, from there, I would say my feeling about nursing has just evolved in a tremendous way. I've just really enjoyed these last, it's been probably 25 years really of working with nurses, and I think the more that as an administrator in the CEO role, the more that I can stay connected with nurses at the front line, the more I feel better about my job, the more that I'm fulfilled in my job, and so it's really kind of, you think, okay, the more responsibility you get, the more you get away from the front line. And I think that for me, if that was to happen, I think I wouldn't be as happy working in this place and in healthcare in general. And I'll say that kind of started 15 years ago or so. Someone told me, one of my mentors, hey, you need to round on the floors and go into patient rooms, talk to patients. And so I started doing that, and I realized that wasn't necessarily just for me, or to find out, okay, is housekeeping doing their job? Are the patients satisfied with their care? All those things. Is food service working? But it really turned into, one, me realizing why I'm in my job, why I do what I do. And the other thing about that is it enabled me to start talking to the nurses, really the care that's going on at the bedside, and working as a team to figure things out. And I've carried that with me since in my current job. I still try to do that. I will say one of the most things that's really brought that to light even more in my feeling about the role of nurses and how important they are is our quality department. Kristin and Lisa Didion asked me and others to start running our safety huddles so we rotate every 5 weeks. I'll do that. I'm doing it this week. And at 8:30 in the morning, we run the safety huddle, and so that's the frontline nurses coming to a huddle, and we talk about challenges, good things, mostly problems, and so we go through that, and that's really just, it kind of made me realize even further that the closer I get to working with nurses, the more I realize the importance of the role that they do, and makes me so much more happy and fulfilled about the work that I do, because I get to work with them. And so it makes me realize that no matter what, whether it's COVID, whether it's whatever it is, it makes me realize how we'll always be successful, no matter what the situation is, because of the attitude that our nurses have, and that they always find a way to make it better for the patient. So anyway, thank you, and I appreciate, again, congratulations to all of you.
They're not nurses. They don't wash their hands like us. So we received a total of 19 nominations for our 2020 Nursing Awards, 12 nominations in the category for All-Star, and 7 nominations for our Hall of Fame. I will now ask Jason Zimmerman and Ellen Hansen to come forward. They'll be assisting with the recognition. After each category, after each category is introduced of the nominees, we will present the winners for that category. Now, on to the awards. The All-Star Award is given to the nurse who exemplifies the art and science of nursing, practicing with skill and integrity. The All-Star Nurse demonstrates outstanding delivery of care and customer service and contributes to the quality outcomes, is committed to the organization and its community through participation in quality projects, serves as a mentor to peers, demonstrates growth in professional practice, promotes a safe and healthy working environment, fosters teamwork and collaboration with their department and beyond. For the nominees, as your name is called, please walk the red carpet to receive your pin and then return to your seat. The nominees for the 2020 All-Star Award are Catherine Cheney, Nurse Practitioner, School of Medicine, Otolaryngology, Head and Neck Surgery, nominated by Tristan Harris. Our next nominee, Christina Caldwell Rn for Wiser, nominated by Jacob Crouch. Cynthia Broom, RN Care Coordinator, Center of Telehealth, nominated by Tanya Tucker. Heather Vaughn, Research Nurse Manager, Clinical Research and Trials Unit, nominated by Galen Marshall. Jacob Crouch, Nurse Educator for Wiser, nominated by Leanne Harcharik. Jacob couldn't be with us. Leanne will be accepting on his behalf. She couldn't resist the opportunity to walk the red carpet. Chrissy Goodson, Nurse Practitioner, Center of Telehealth, nominated by Tiersany Davis. Lacey Dungan, Abdominal Transplant Coordinator, Liver Transplant Department, nominated by Anna McGraw. Mary McAlpin, RN Care Coordinator, School of Medicine, Neurology, nominated by Dr. Mark Anderson. Morgan Glidewell, RN 3 South, nominated by Athelia Bolden. Nikki Stevenson, Manager, Process Improvement, School of Medicine, Otolaryngology, Head and Neck Surgery, nominated by Anna Kate Stanford. Yes, Nikki couldn't be with us today. Sandra McCraney, RN Care Coordinator, School of Medicine, General Surgery, nominated by Carmen Polk. Shawana Brown Lowe, LPN, School of Medicine, Neurology, nominated by Dr. Shaharas Gangadhara. As I call the names of, as I call the names of the winners for the Nursing All-Star Award, please walk the red carpet in the center aisle. Wait till your excerpt is completed, and then you can return to your seat. And the winners for the 2020 Nursing All-Star Award are Christina Caldwell, Staff Nurse for Weiser. Christina is committed to providing quality nursing care and always works as a team player. She is constantly looking for ways to improve the experience for the patients in her care, as well as for her coworkers. She has displayed on multiple occasions her commitment to UMC and the values for which the organization stands. Christina regularly receives DAISY nominations from her patients and their families. Excerpts from a few of the nominations tell us that Christina constantly brings joy to the patients she encounters, and that she was never too busy that she couldn't answer my questions or help with my needs. Christina is active on several committees and serves as a preceptor, is a hand hygiene champion, and has even created a study group for the nurses on 4 Weiser who were preparing to take their Med-Surg certification exam. Congratulations, Christina. Our next All-Star winner, Cynthia Broom, RN Care Coordinator from Telehealth Remote Patient Monitoring. Cindy's passion for patient education, reducing health disparities, and improving chronic conditions is evident in everything that she does. She spends a lot of time getting to know each patient via telephone and their specific needs and barriers in order to determine which educational tools best meet their needs. Cindy's experience with the remote patient monitoring began about 7 years ago when she served as the nurse for UMC's first remote patient monitoring study in rural Mississippi, working with diabetic patients. Cindy spent time with each patient creating individualized care plans and providing one-on-one education. She was so dedicated to the success of the study, she moved to the area temporarily in order to dedicate as much time as possible. The results of the study were so profound, this led to Mississippi legislation mandating that payment for remote patient monitoring by all insurance carriers. Cindy continues to work in the remote patient monitoring and is considered a leader in the program. Congratulations, Cindy. Our next winner, Jacob Crouch, Nurse Educator for Weiser. Jake has a passion for teaching and helping others. He is creative in the way that he delivers new information to staff. He adjusts his methods to ensure that all staff have an understanding of what is being taught. He is an active member of the 4 Weiser Unit Practice Council, Value Analysis Team, CLABSI Team, and Hand Hygiene Committee. Through his work on the Value Analysis Team, he researched and helped develop a method for bathing patients to help reduce the risk of catheter-associated urinary tract infections. The project was trialed on 4 Weiser with such success that CAUTIs were reduced on that unit, and it was implemented across the organization. Jake has spent countless hours researching best practices and efforts to streamline processes, provide the most up-to-date evidence patient care, and ultimately improve the quality of care of patients on 4 Weiser. He is perhaps the only person in this room that has traveled to North Korea, an adventure that he took back in 2015 to the university where he presented on telehealth nursing in the rural community. The university is adding a school of nursing and will need English-speaking instructors, and Jake hopes to fill that role. He will graduate from the PhD program in May of 2021. Congratulations, Jake. You couldn't resist. One more time, huh? And our final All-Star winner, Lacey Dungan, Abdominal Transplant Coordinator in the Liver Transplant Department. As a transplant coordinator, Lacey's role is to navigate the patient not only through their liver transplant system, but also through UMC system and other outside facilities as a whole. For her post-liver transplants, she must constantly advocate to ensure timely and quality care for the patient. Lacey participates on inpatient rounds and monitors her patients in the hospital, despite her primarily outpatient role, to assist with the coordination of their post-transplant care. One of Lacey's patients said this when asked about her commitment to the patients. She's not once been not available, nor has she strayed from the same personable attention that gives me peace in knowing that I am not alone in my transplant journey. Lacey is described as a tireless advocate for her patients, extremely intelligent and a skilled clinician, and a real driver of quality improvement with the transplant department. Some of Lacey's projects and ideas have included revisions of protocols, revisions of letters, changing processes involving lab work collections, clinic workflows, and changes to call schedules to improve satisfaction and burnout. Lacey's experience and calm demeanor in a high-stress environment fosters teamwork and collaboration. Congratulations, Lacey. Congratulations to all of our All-Star nominees and the winners. Now on to our next award, the Hall of Fame. The award for Hall of Fame is given to a nurse who has practiced at UMMC for at least 10 years. In addition to the qualities mentioned in the previous category, the Hall of Fame nurse also serves as a respected leader who promotes positive change and collaboration, applies nursing knowledge to support UMC nurses in meeting standards and regulatory requirements that promote safety and quality outcomes, is involved in the development of innovative programs, activities, or products that impact UMC processes, budgets, and/or patient care, exhibits knowledge and skill in a way that have impacted quality care and improved patient outcomes, has guided, supported, and influenced nurses in career and professional development, has participated and or led community service efforts for healthcare, and has elevated the nursing profession at the local, state, or national level. The nominees for Hall of Fame are Connie Richardson, Director of Nursing Adult Services, nominated by the Weiser managers and her peers. Joanna Geraldo, RN 3 South, nominated by Martha Holmes. Joy Akanji, Nurse Manager, Student Employee Health, nominated by Tanya Moore. Julie Jones, RN Patient Navigator, Children's Fetal Center, nominated by Laura Hendon. Kristin Kapler, Director of Quality and Clinical Support Services, Children's Administration, nominated by Kim Barrier. Nikki Karan, Nurse Manager, 5 Children's, nominated by Dr. Mary Taylor. Nikki couldn't be with us today. Dr. Taylor, you want to receive her pin? And Terry Gillespie, Chief Nursing Executive Officer and CNO Adult Hospitals, UMMC Health Systems, nominated by Dr. Christopher Anderson. Again, as I call the winners, I ask that you come forward and stay until the excerpt about you has been completed. Our first winner for the 2020 Hall of Fame is Connie Richardson, Director of Nursing Adult Services. Connie has served her entire nursing career at the University of Mississippi Medical Center. She began as a staff RN in the labor and delivery and worked her way up to manager and was promoted to the Director of Nursing, where she has served for the past 16 years. Connie's nominators state, Connie is without a doubt exceptional. She is a servant leader who continues to be a formidable bedside nurse despite her administrative role. She is quick to put on a pair of scrubs and jump right in to help when the need arises. Her response has always been, where do you need me? Connie has worked tirelessly on various committees and task forces throughout the hospital. In recent years, she was a huge part to support the mother-baby team as they achieved the first mother-baby friendly status in the state of Mississippi. The mother-baby team was also recognized as the 2018 Team of the Year at UMMC. She has had multiple managers nominated for Daisy Awards as nurse leader, and one taking home the prize. She volunteers her time and expertise to work on many task forces which positively promote or impact patient care outcomes. She has seen the Wiser team through a progressive era with an innovative approach with steadfast grace with which she faces all change. These changes include a total renovation of women's urgent care, allowing for a more family-centered approach in clinical practice, and evolving from an all-women's hospital to a hospital that also cares for med-surg patients. She leads by example while fostering growth for those with whom she works. Connie is approachable and will lend a listening ear while remaining objective and unbiased. Connie obtained her MSN from UMC School of Nursing. Congratulations, Connie, and welcome to the Hall of Fame. Our next Hall of Fame winner, Dr. Joy Akanji, Nurse Manager, Student Employee Health. Dr. Akanji started her career at UMMC in 2005 after she and her family were relocated from New Orleans due to the events surrounding Hurricane Katrina. In her current role in the Student Employee Health, Dr. Akanji put in place expectations, standards, and protocols that have led to process improvement, increased staff morale, and decreased staff turnover. She has implemented various strategies to decrease wait time for customers, creating a streamlined and improved flu blitz process, creating an online volunteer sign-up process to support nurses with community service hours, and led efforts to decentralize the process for TB skin testing and modernize the requirements for annual TB renewal. Dr. Akanji participated in a national mentoring program offered by the American Nurses Association and regularly provides support and encouragement to staff. Dr. Akanji has a fascinating educational background and nursing career that began when she earned her diploma in nursing and midwifery in 1979 and 1981, respectively, from Nigeria. I'm just reading, Joy. I didn't put it in there. She later obtained her Bachelor of Science in Nursing, Master's of Science in Nursing, and her Doctorate of Nursing Practice. Lifelong learning is a value that Dr. Akanji embraces and continues to demonstrate. Dr. Akanji has been nominated and received numerous awards at the local, state, and national level, and is an active member in several professional organizations and an active in numerous community events and organizations. From her nomination, Dr. Akanji unselfishly shares her time, talent with others. She's a beacon of light to many. Without a doubt, Dr. Akanji continues to leave a positive impact on UMC, the community, and beyond. Dr. Akanji, congratulations and welcome to the Hall of Fame. Joy, for those of us that have known you for years, my most fond memory of you is the tiger system. Can you give us the growl? The tiger growl. There you go. All right. Our next winner in the Hall of Fame, Kristin Kapler, Director of Children's Quality and Clinical Services. Kristin essentially built the Children's Quality Department from the ground up and has spearheaded several initiatives that have improved the health and safety of the children of Mississippi and taken quality at our institution to the next level. Kristin started the work with the Solutions for Patient Safety, a network of 140 plus children's hospitals throughout the US and Canada that work together to eliminate patient harm. Through this membership, Kristin has led multidisciplinary teams to implement patient care bundles to reduce central line infections, pressure injuries, surgical site infections, and unplanned extubations. This type of work is not always easy. Implementing best practices involves people changing how they do things, and change is not always looked upon as positive. Kristin masterfully navigates these challenges and manages to enact change gracefully without stepping on anyone's toes and ensuring that all voices are heard. Kristin plays leading roles in numerous other committees and task forces and was an instrumental figure in the Children's Hospital Expansion Project. Kristin was part of the team that implemented the RISE program at UMC, and is one of the handful of change leaders at the institution. On the national level, Kristin serves as the South Regional Champion for the Solutions for Patient Safety and leads multidisciplinary teams from 12 different children's hospitals in the southern United States in developing and implementing strategic initiatives to reduce patient harm. Kristin recently attained her Master's in Healthcare Administration and became a certified professional in patient safety. From her nomination, Kristin exemplifies the qualities of a good leader: integrity, confidence, commitment, passion, and humility. Congratulations, Kristin, and welcome to the Hall of Fame. And our final Hall of Fame recipient, Nikki, Karan, Nurse Manager, 5 Children's. As a manager of 5 Children's and 3 Children's, Nikki ensures that patient experience is mandated, not only focusing on patients, but also focusing on the teams that she leads. Nikki's style of leadership involves working with others as a full partner in the context of mutual respect and collaboration, which has been associated with improved patient outcomes, reduction in medical errors, reduction in length of stay, increased job satisfaction, retention among nursing staff, and improved overall work. Nikki completed many quality projects, including the implementation of a new process to request ultrasound-guided IV access and the development of acuity tool to utilize when placing calls to the ultrasound team. She also developed an acuity tool that scored red, yellow, and green according to how many tasks the patient was required during the shift, which provided a framework for the charge nurse to assign patients appropriately. Nikki has implemented nurse leader rounds, rounding on every patient every day, and has also developed a tool to track these rounds and provide follow-up to the patients and their families. She is a nurse manager who prides herself in providing the support to allow her team to have both the autonomy and a voice as the patient advocate. According to Dr. Scott Simpson, pediatric cardiologist and medical director of Batson's 5th Floor, Nikki is amazing. She is a natural leader for South. She began as a strong nurse with a compassionate bedside manner and a solid understanding of the complex anatomy and physiology of our unique patient population. She is a hardworking and always thinking about how she can help the nurses and her staff. Nikki recently obtained her MSN in Healthcare Administration and is currently enrolled in the Doctorate of Nursing Practice program here at UMC. Nikki Karan, welcome to the Hall of Fame. Again, congratulations to all of our, I'm sorry, Dr. Taylor. Again, congratulations to all of our nominees and to our 2020 Nursing Award winners. We would also like to show appreciation to those who took time to nominate all of these fantastic nurses. Now I'd like to introduce Margaret Head, our Chief Ambulatory Officer, who will come and give us some closing remarks. Oh, it won't prompt. There it goes.
So I just want to say a few words, and I know everybody's waiting to hear from Terry, so I'm not going to hold up too long. But I just want to say, no matter what business role I have, that at my core, I am a nurse. It's a core part of my identity and a core part of my heart. So I've never will leave that, no matter what role I serve. So, go nursing. All right. So, and I think ceremonies are a really important part of nursing culture. And I like this culture here at UMMC because it's inclusive. So if you just look at your program, you'll see that we have inpatient nurses, we have ambulatory nurses, we have advanced practice nurses, we have care coordinators, we have telehealth, population health, quality, process improvement, education, management. You know, it's a broad, nurses are changing the healthcare landscape all across this country, and so many different roles and so many different avenues that I think we really just need to stop and just reflect about. No matter where you work, you can really serve to improve care for your patients and care for the families that you serve. So thank you all for everything that you do. No matter where you work and what you're doing, it all fits into how we're really impacting health outcomes. So thank you. And I was thinking back about the year of the nurse, 2020. And so I went to nursing school a long time ago, kind of like Joy, okay? So, and a few others in the room who I won't mention. And we had a lot of ceremonies when I was in nursing school. We had the pinning ceremony, we had a capping ceremony. I don't think they do that anymore. And then our graduation candlelight ceremony. And so the most important part I remember when I was, we had a candlelight ceremony and we had to all recite the Nightingale Pledge. And so the Nightingale Pledge was written in 1893, the first version. It was what set us off into the world on our career. So I would just like to read that again for everybody, just to remind us where we started, how far we've come, and how far we're going to go, okay? So I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I shall abstain from whatever is deleterious and mischievous. I didn't do that, sorry. And shall not take or knowingly administer any harmful drug. I shall do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping, and all family affairs coming to my knowledge in the practice of my calling. I shall be loyal to my work and devoted towards the welfare of those committed to my care. Thank you.
And now I would like to invite our Chief Nursing Executive Officer, Dr. Terry Gillespie, to come share her thoughts.
Thank you, Keith. First, a few thoughts about the ceremony. I agree, ceremonies are something that nursing does really well, and this has been a gorgeous ceremony. I said earlier to someone, if anybody could transform a classroom wing into something that looks this gorgeous, it's definitely our Office of Nursing Development, Quality, and Professional Practice, along with their cohorts in the Children's Hospital. So I'm very thankful for this ceremony. I'm thankful for every nurse that was nominated, that won, and I'm thankful for every nurse that I hope is listening on Facebook Live. And so I asked Adrienne, and she gave me the go-ahead that I could take just a little bit of time to reflect on the fact that this is my last nursing awards, and it is bittersweeted. So thankful I didn't miss this. I almost did. But it means a ton to me to be here. I've been a nurse since 1983. I've been a nurse in my heart since long before that. It's all I've ever wanted to be. I've never regretted a minute. I could possibly get teary, so bear with me. And in thinking about what parting words I would want to leave with every nurse that I have grown to love in this family that I call UNMC, I think it's best summed up by Rascal Flatts. So I hope the days come easy and the moments pass slow, and that each road takes you where you want to go. And if you're faced with a choice and you have to choose, I hope you choose the one that means the most to you. And if one door opens to another one closed, I hope you keep on walking till you find that window. And if it's cold outside, show the world you'll smile. I hope you never look back, but you never forget all the ones who loved you in this place that you live. I hope you always forgive and you never forget, and you help somebody every chance you get. I hope you find God's grace in every mistake and always give more than you take. But more than anything, more than anything. My wish for you is that this life, this nursing life, become all you want it to. Your dreams stay big and your worries stay small, and you never need to carry more than you can haul. And when you're out there getting where you're getting to, I hope you know that I love you. Thank you all. I have had a wonderful career. This has been a wonderful ceremony. I love you all more than you'll ever know. Thank you.
Thank you, Terry. And now I'm pleased to invite our Director of Pastoral Services, Chaplain Doris Whitaker, to lead us in the blessing of the hands.
Good afternoon. If you would like to participate in this blessing, please stand and lift your hands. Almighty God, we bless these hands that are lifted up to you. Thank you for those who have courageously accepted the call to nursing, to health care. Bless them all the days of their lives. I thank you that they are the ones who make the unbearable in health care bearable. Not only by their touch do you bring healing, but by their smile, by their compassion, and by their attitude. We are grateful for these hands that are lifted to you. Amen.
On behalf of the Office of Nursing Quality Development and Professional Practice, we want to again congratulate all of our nominees and all of our winners. Thank you to those here in attendance, and special thanks to those who are attending via live stream. We ask that at the conclusion of this program that both the nominees and the winners do stay for photos. Again, congratulations to nominees, winners, and all nurses at UMC.